Hello, this is Dr. Tom Groover from Boulder Chiropractic Clinic. I'm here today with my spine and want to talk to you about an important topic that comes up all the time in my practice. And that has to do with the appropriate amount of pelvic tilt and low back curvature. And we see this all the time with dancers and athletes and people who are into physical conditioning, people who take yoga, people who do Pilates. We see that there's a tendency to fight the curves of the spine, to try and flatten them out, and to try and reverse the pelvic tilt, thinking that that's desirable, that maybe that's activation of the core, abdominal core, that it's more aesthetically pleasing in dance. We see that particularly. And I can think of a case where a very advanced Broadway dancer came to my office and had told me that her dance coach was trying to get her to tilt her pelvis to posterior rotate her pelvis to flatten out her lower back. Now, that has become sort of a universal instruction from time to time, and I know things are changing on this, but I want you to hear this from me. Now, here's the thing. The low back curve is there for a reason. It serves as a spring. It serves as a way to transfer weight effectively down from the upper body down into your pelvis and legs. And when you have a curve in your low back and you fight that curve and try and flatten it out, what you're doing is really affecting the mechanics, usually adversely affecting the mechanics of the way the vertebral joints work and the way that the weight is supported in the low back. And so what we have here are vertebra. These are the low back vertebra. Okay, so we have the sacrum, L5, 4, 3, 2, and 1, lumbar vertebra, all right? Now, in between these vertebrae are intervertebral discs. And on the back side of these vertebrae are facet joints that run here. Now, on either side are holes between the vertebrae called intervertebral foramen, and there are lumbar nerve roots that come out of that area. Down here, there are sacral nerve roots. Okay, so what you need to know about this is that the anatomy of the low back is designed to have curve, that these discs have angles. They open up in the front and close down more in the back. So the vertebra need to conform to the natural basic shape of the disc to a large extent, but with the correct amount of lumbar curve, what you have is the alignment of these facet joints, these joints that allow you to bend forward and backward primarily in the low back. And when these facet joints are stretched open, then what you have is a misalignment of the vertebrae. You have a mechanical problem here. And the mechanical problem is going to be such that the capsular ligaments that hold these facet joints together are going to be under a lot of tension. And they're going to get stressed and painful. They'll get inflamed and they'll get injured. The mechanics of the joint are thrown off here, where these articulations of the vertebra below with the vertebra above, the mechanics are thrown off, and those will start to degenerate and deform, and cartilage loss will occur. And then the other thing about it is that the disc then will get squeezed down on the front side, and you'll begin to lose disc height. You'll begin to lose the cushioning effect and the stability, the stabilizing of the disc in the picture. So the problem here is an overall problem of stress, mechanical stress, inflammation, and pain that becomes a neurological stress that will make these lumbar nerve roots stop functioning the way they're supposed to. And when these nerve roots cease their normal function, what you'll find is that you have problems with strength, with coordination. You have problems with activation. you have major problems getting the core to even turn on very well, but you can't really operate your hip muscles very well because those are innervated by your lumbar nerve roots. So what we do here in the office is we usually find, first of all, that people have hip muscle weakness, and we know for a fact that the lumbar spine is misaligned. We take an x-ray of the lumbar spine, of the whole spine from the side, but specifically we focus on the lumbar spine and measure the disc angles. And if they fall within a certain range, we know they're normal. If they're too great, in other words, the low back really bends really too much, then we know that these facet joints are under a huge amount of strain. They're overloaded. If the lumbar spine if the disc angle is too little, what that means is that the lumbar spine is pushed forward too much, and these discs are really under too much load on the front side, and you're in danger of injuring your disc really severely because there's a nucleus in there that's in the front part of the disc. It can get thrown to the back side because of this squeezing effect, and if it goes on for too long, can punch through the wall of the disc and squeeze down on this nerve root and even get into the neural canal and hit your spinal cord. And these are real serious problems that oftentimes require surgery to fix. So what I'm recommending is that before you just indiscreetly begin to try and flatten your low back curve because you think there's something wrong, or you start tilting your pelvis back like this to try and flatten everything out, that you get a professional assessment of your curves. You should have your pelvic angle measured. You should have your low back examined physically, x-ray analysis, take x-rays and do the line drawings and measure the angles. And then when you know the picture, then you can get these things adjusted appropriately so that if you need more curve, the adjustment will go in that direction. If you need less curve, the adjustments can go in that direction. And also recommendations for how you exercise, how you sit, how you stand, how you walk, how you run, how you lift. All of these things, how you pick things up. All these things fit into the picture of maintaining a healthy curve in your spine. Now, one other thing I can say is that if there's too much apparent curve here, you need to check and see if you have a pot belly. If your belly sticks out, all right, when you're standing or moving, it'll make your back look like it's too much curve. So you might want to work on that pot belly. And if you don't activate your abdominal core, which means pulling your tummy in towards your spine when you're using your spine, if you don't do that, then it'll make you look like you have too much curve in your low back. So I hope this really helps out. What I would say is that if your back is too flat and you persist in doing forward bending stretches, you're going to end up with a lot of problems because the flat back is already a problem, and then if you keep flattening it further and you injure the disc, you could end up, under the orthopedist's knife. And I had that happen in my early years of teaching yoga. One of my students wanted to show me how far she could sit and bend over all the way to the floor and flatten out her entire low back and just her whole torso and lumbar spine was on the floor. And I kind of looked at her and thought, that's kind of aggressive. Maybe this is a problem. Well, she didn't come to the next class. I called her at home to see what was going on, and she said that she had injured her disc and she was going in for surgery the next day. So take care of yourself properly. Don't go by trends and fads or any kind of dogma about what you should or shouldn't be doing, particularly from people that take weekend courses so they can become certified in some kind of, exercise class or yoga. You need to be sure that those people are on board with this type of thinking, and if they're not, you need to find someone who is, because universally doing forward bends all the time, like are taught in classes all over the country, for a lot of people is very harmful. They need to extend, they need to bend backward in their low back and stabilize that, and bend forward from their hip sockets down here. So I really hope this helps, and if you have any questions or comments, let me know. I know this is a very controversial subject, and I'm equipped to be able to deal with any feedback like that, any negative feedback I get even. But it's something I really think is important that the world knows, because there are some major problems coming in here with people who've had chronic low back all their lives, and it's because they're doing a hurdler stretch really aggressively, or they're doing, standing and seated forward bends when they do yoga, and that's their favorite thing to do, and it ends up being a problem.